this is what we call a rotation, okay? Now this is a head rotation. Now this is an arm rotation. So now this is abduction and adduction, which is the angular body movement terms that describe a structure moving toward, away from a midline reference point. Okay, so now today, this part we're gonna teach you about circumduction. Okay, so you see my mom, she's doing the circumduction. Okay. Okay, so now we're gonna talk about elevation and depression. Okay, so right now it's depression, now it's elevation. Elevation refers to movement of a body part in a superior direction or moving upward. And depression refers to movement of a body part in an inferior direction or moving downward. So now I'm gonna give you an example of plantar flexion and dorsiflexion, okay? So plantar, dorsiflexion. Plantar, dorsiflexion. Okay, now we're gonna talk about supination and pronation. Okay, supination it's like this, okay, and pronation it's like that. So supination, it's the rotation of radius in lateral direction, leaving thumbs pointing away and palms up or forward. And pronation is the rotation of radius in middle direction, leaving thumbs pointing medially and palms down or back. Así nomás. Pronation. Okay, now I'm gonna show you what is inversion. That's inversion, and this is eversion. So inversion, eversion. Eversion so turns toward body's midline. And now eversion so turns away from body's midline. Flexion, which is decreases the angle between the two structures as they bend or move closer together. And extension increases the angle between two structures as they straighten or move farther apart. So, flexion, extension, flexion, extension. So I'm gonna show you an example of synovial joints, okay? And this is in the webpage of Physiopedia, okay? So you can see, here's an example. As you can see, that right in the hip, this is called the condylar joint, the ball and socket joint right here, in the hip joint, right? The pivot joint between C1 and C2 vertebrae, the hitch joint right in the elbow, and the saddle point right between the trapezium carpal bone and the fourth metacarpal bone, okay? And this one, the plane point between the tarsal bones. So this, whenever we do an elbow x-ray, okay, we put the cassette right in the middle here, okay? And the first image is usually an extended arm, okay? So this is an example of extension. And whenever we do a lateral view, it's an example of a flexion, okay? You should do like this. Now this is a supine position, okay? On supine positions, we do like what you call the lumbar spine, KUBs. Also do pelvis. This is the supine position, okay? Just laying down. So now, what about if the patient cannot lay down due to back pain and she cannot do a supine position? Then I can do an upright x-ray of the back. For example, like I can put the SIDF 40 and I can put the central ray right here, just like I'm doing a supine, but this time it's going to be upright. I just have to put the marker that is the position is going to be upright due to that she couldn't do supine position.